Good afternoon to everyone. My name is Celia Christopher. I am the Director of the Department of Gender Affairs, and I'm here today to inform the general public on the work of the department, as well as to give you an update on its activities as it relates to the COVID pandemic. The role and function of the Department of Gender Affairs is primarily to raise awareness of gender-related issues, including health issues, especially on behalf of vulnerable populations. This is done through advocacy, education, and empowerment, utilizing programs that promote gender equality, growth, and development. The department cannot do it alone, do not have the capacity to do it alone. And that is why we utilize a multi-agency and holistic approach by forming partnerships and collaboration with the public and private sector, faith-based organizations, NGOs, civil society, and international agencies. The department functions under a legislative and policy framework which is guided by international and regional commitments such as the Sustainable Development Goal, CEDAW, and other conventions, which requires periodic country reports. Nationally, the protection of complainants has been strengthened with the development of the Domestic and Sexual Violence Complaint and Response Protocol in consultation with key stakeholders, including the private and public sector, NGOs, faith-based organizations, and civil society. The protocol was launched in 2018, which sets out the roles and responsibilities of key stakeholders involved in domestic violence. The department's priority at this time include A, the completion of the implementation process for the complaint and response protocol, B, the continued development of the national gender policy, C, the formal submission of the St. Kitts and Nevis CEDAW report, which speaks to the Convention on the Elimination of All Forms of Discrimination Against Women, D, poverty alleviation, E, the empowerment of women and girls, F, program for men and boys, and G, gender sensitization. As we face the COVID-19 global pandemic and its health and economic effects, gender inequalities are often intensified during difficult times. Accordingly, the restriction on movement means that more persons are required to stay at home, which can be challenging, especially those persons facing difficult relationships and who usually do not spend a lot of time together. UNFPA has also stated that evidence from prior outbreaks indicate that women and girls face higher risk of intimate partner violence and other forms of domestic violence due to heightened tension in the household. Statistical data from the local police intelligence office for the period January to April 2020, as it relates to the types of cases being handled by the Department of Gender Affairs, indicates the following. A total of 67 cases of domestic violence were reported involving 57 females and 10 males. It includes 48 cases of physical abuse, 15 cases of verbal abuse, 1 case of financial abuse, 3 cases of psychological abuse, and other offenses such as 14 threats to kill and 40 cases of battery. The support services available at the Department of Gender Affairs include, but are not limited to, referrals to a number of departments, organizations, and agencies such as social services, legal aid, the Labor Department, pastoral counseling, faith-based organizations, clinical counseling, mediation, the National Housing Corporation, and the Special Victims Unit. Having shared that information with you on the role and function of the Department of Gender Affairs, I will now update you on our current activities as it relates to the COVID-19 pandemic. In terms of capacity, the department is currently operating at the level of 3 officers working at reduced hours as we strive to adhere to the COVID-19 protocol. Accordingly, persons seeking information from our office can do so by calling 662-5492. However, if you decide to visit the offices, you are expected to sanitize your hands, wear a mask, and be prepared to practice social distancing. Our office currently operates from 2 locations: the main office, which is located at the Ministry of Community Development on Victoria Road, and the second office located at the Newtown Community Center. The working hours are from 8 a.m. to 12 noon on Mondays, Tuesdays, and Wednesdays. If you are a victim of domestic violence, and if for any reason you are feeling afraid, there are a number of agencies available to help you. These include the Department of Gender Affairs at 662-5492, the Special Victims Unit at 665-3091, the Counseling Unit at 662-8086. In addition, emergency assistance can be sought from the COVID-19 hotline at 311. Further information on the Department of Gender Affairs can be found on its Facebook page at www.facebook.com/Department of Gender Affairs St. Kitts/ or email skngenaff@gov.kn. Finally, I want to thank all healthcare workers, particularly the doctors and nurses, for their selfless commitment to service in such a time as this. Happy International Nurses Day to all nurses. Thank you.